Hey guys, this is Dr. Sheth, and you're watching this video because you've had a tooth extracted at our office. We're going to go over a few little post-operative instructions so that you can have a pain-free and pleasant healing process. The first thing is I want you to bite firmly on the gauze for the next 35 to 45 minutes. Just keep firm pressure, and that's going to help the blood clot right around the extraction site or surgical site. I want you to keep your head elevated above your heart for the rest of the day. I want you to restrict your activity, no intense labor or exercise for the next few days. I want you to stay hydrated and eat nutritious foods. I don't want you to eat anything coarse, anything such as popcorn, nuts, or any kind of food that could get stuck in the extraction site or the surgical site itself. I'd like you to refrain from eating any kind of acidic food. Stay away from alcohol and caffeine for at least the first 48 hours. Alcohol and caffeine, it can reduce the amount of blood flow in the area. I want you to take your medications as prescribed, and I want you to take them until completion. If you start an antibiotic, I do want you to finish that. I want you to brush your teeth and minimize the use of toothpaste. When you rinse your mouth out, I just want you to rinse it out gently and then kind of let the liquids fall into the sink. We don't want you to vigorously spit out those liquids, as that could incidentally kind of blow out the clot and lead to a complication. I don't want you spitting for 48 hours at least, and no rinsing with mouthwash, as the alcohol in the mouthwashes and the chemicals in the mouthwashes can irritate the gums and tissue. You can use saltwater rinses as directed, but I would at least hold off for the first 24 hours. If you're a smoker, I definitely don't want you smoking at least for the next 48 to 72 hours. So really try to hold off, as your risk of dry socket increases from smoking. Should you begin to bleed heavily, I want you to bite down on some damp gauze. Keep firm pressure on it for the next 30 to 40 minutes. I then want you to change that gauze out. You may notice that the gauze will look pink or red. That's okay. Just first change it out and see what it looks like the second time. If it's getting better, and that means if it's looking less bloody, things are moving in the right direction. If things are really red and the gauze itself is extremely saturated, I'd like you to call the office immediately. Your pain should subside over the course of a week, probably with the third day being maybe the worst day and getting better every day there and after. If your pain isn't controlled or isn't getting better after about day 5, I really want you to give our office a call so we can take a look and make sure nothing's going on. Hopefully these things will just kind of lead you down the right path to a successful surgery. And if you have any questions, please feel free to give our office a call at 480-536-9050. Once again, if you have any questions, please feel free to give us a call.